My name is Anika Evans, and I'm a community member of District 4 Upper Santan Village. And I have lived in the community since I was about 24 years old. When I first came home to Gila River from Texas, I was a tiny little motorcycle horseback riding person, size 3, weighed 110 pounds, and I think that coming home was very different for me culturally because I had always been a runner and very active, and my physique wasn't well received. So over time, my habits changed to match the habits of those around me so that I will look more like my other family and peers. I felt that if I looked like them more, then maybe they would pick on me less. But in time I realized that I needed to be healthy for myself, and that my own lifespan and my own quality of life is affected by not having so much weight. At first when I came with a friend who asked me to join her as her own support in her prevention journey. And then in January of 2019, my own doctor sent me as a referral patient because my A1C was too close and I was on the verge of becoming a full-blown diabetic who would be insulin dependent. I would say the availability and the consistency of being able to come and meet with the counselor and talk with her and having her go through the shoulds and the should nots and teaching us how to cook better. Just the consistency. My life has changed from being in the diabetes prevention program because I'm a lot more aware of the amount of fat that we consume in our cultural diet and what I was consuming in my habitual diet and the food that I was ordering when I would go out to eat. And over time I realized that the claims that our bodies were craving sugar and fat were actually true. And it took me a little bit to retrain my brain that my body felt better without all of the fat and the sugar. My family was not very excited about not eating out as much. Basically, my daughter was adapting to my new way of cooking with low-fat cheese and low-fat milk, low-fat yogurt, low-fat ice cream if and when I would allow us to have ice cream. And she was getting used to me saying no when she would ask for pizza and burgers. And I think over time it became more acceptable to her because she realized that I was feeling better about not being insulin dependent and that my weight was dropping and I was able to fit my clothes and be more comfortable. And I think my own satisfaction with my journey helped her to accept our new diet. In just 2 years from starting my new job, I had changed my exercise and eating habits so drastically that I put on quite a few pounds and I was continuously growing or maintaining, but I was starting to fit the clothes that I was wearing when I was pregnant with my daughter 14 years ago. And that was a little discouraging. But I had to come to the realization that it was my own habits that were influenced by my work environment and my schedule and my own priorities. But when I finally understood how the fat grams were causing me to retain the weight, and how I wasn't exercising enough to burn off all of the fat that I was consuming, then I realized that I could balance it out with my own behavior, and then my clothes started to fit again, and my A1C dropped way back into normal levels, and I'm nowhere near being borderline diabetic anymore. I would say there is a huge level of education and the accountability, the support, and the partnership that I felt from my interaction with my diabetes prevention counselor would be the main reasons I would recommend this program to other community members and hospital patients.